You are tuned into Fever 104 FM with me, Shine, on the Superhero Show. And hello and welcome to today's health awareness segment. Now, India is often referred to as the diabetes capital of the world. With millions of people living with diabetes, this number actually continues to rise every year. As per a WHO report, 69.2 million people suffer from diabetes in India. Now, while most people are aware of complications like heart disease, kidney problems, or vision loss, one serious complication often goes unnoticed, and that is diabetic food ulcers. A small wound blister ulcer might seem totally harmless to all of us, but if it's ignored, it can progress rapidly into severe infection and, in some cases, even amputation, which makes early diagnosis and timely intervention extremely critical. Celebrating World Plastic Surgeon Day, with us in the studio today is Dr. Kiran Petkar, plastic surgeon at Kaveri Hospital, Electronic City. Sir, first of all, thank you so much for taking time out and coming here. A happy Plastic Surgeons Day to you, sir.
Thanks, Shan. Glad to be here.
Oh, it's my pleasure to have you here. Can you, to start off, since you're a plastic surgeon and today's Plastic Surgery Day, can you start off by telling us a little bit of how a day for a plastic surgeon look like? How does a day for you look like, sir?
Well, yeah, it looks like any other day for any other surgeon. Like we go to the operation theatre, do the surgeries of the day, and then come to OPD, see some cases, and rounds, and evening with friends. Until a call comes from the emergency room.
Doctor, today we're talking about a thing called diabetic foot, which is not discussed among like other diabetic complications. So, can you tell us what is a diabetic foot and how serious is that issue?
Well, it's a serious thing. Well, see what diabetes does to you. It damages your nerves, your vessels, not over a period of short term, but over a period of decades. If your sugars have not been controlled over a period of several decades. Because of which the nerve sensation is lost in the foot, because of which a small wound happens there. If a patient, there's a prick in the foot and the patient does not know about it. And leave it for a couple of days, it grows into a bad wound. And the healing capacity is also not good. So what happens, even a small seemingly innocuous wound has already grown big by the time it is noticed.
Now, people don't generally think of a plastic surgeon that they have to go to for a diabetic foot management. Now, what role do plastic surgeons play in management of a diabetic foot?
Yeah, amongst other things, we are also wound experts. Like we manage the wound from beginning till the end, especially the end part is where plastic surgery really comes into being. There's a wound, the patient has lost the tissues, and we come and optimize the wound for coverage. Coverage for the wound and for the issue. Like if he has lost skin, we replace the skin. If he has lost skin and soft tissue, we replace it with flaps. And so many other modalities. And we bring their form and function back to normalcy as far as possible.
Now, there is a term which I hear about diabetic foot care, and that is time is tissue. Can you explain what is that for us, please?
Yeah, for Janta ke liye main bata दूं. Tissue is not in the sense of tissue paper or anything. Tissue is a specific part of the organ.
Right.
Like bone is a tissue, skin is a tissue in that leg. Leg is an organ, and nerve is a tissue, fat is a tissue.
Right.
Like there's a wound on the heel or toes. Like earlier you seek the intervention, you can save maximum of your native tissues.
Right.
Or the tissue damage goes on spreading, and later you come, we will have no other way but to take off the damaged tissue, rotten tissue, and then you have lost it. Like many people lose their toes, they lose part of their foot. Many people lose their limbs because they have reached late. That's why we say time is tissue. You reach your doctor early and save your own native tissue so that you can walk on your own foot. That's the idea.
When you say time is early, can you tell us about some warning signs that people should look out for?
Yeah, every diabetic person should watch his own foot, or if you have a diabetic patient at home, you should watch with your eyes, you should wash their foot every day. That's what I tell my patients. Because a wound might have happened maybe by a prick, or maybe by the patient may be sitting on a charcoal, burning charcoal, or even a callosity like the hardness of the toes or the foot. That itself can press, or when you have worn a new shoes, new footwear, that must be causing damage, but you're not aware of it because your nerves are not carrying the sensation back to the brain. So you don't know there is a wound just by the feeling of it. So instead, if your family member, or if you have the habit of looking at your feet every morning or every evening, you can spot a wound there. And if there is a wound, you reach out to your doctor.
So, but a wound is generally something that heals on its own. That's what we do, right? So, how long should they watch for that? Okay, if the wound is there for a couple of days, let's say, then you should immediately consult a doctor.
Wound naturally heals in a healthy
Body.
environment. But in a diabetic foot, the sugars are more in the tissues, the nerve sensation is lost, and there's reflex through the nerve sensation, because of which the natural defense mechanism is recruited. That is poor in diabetic patients. Because of all these reasons, and the blood circulation is poor because the blood channels are also blocked with the sclerotic changes. So because of so many reasons, the wounds do not heal well in the diabetic patients. You need care, you need expert care.
Can you tell me about your journey of becoming a plastic surgeon? This is something that we were discussing before the interview started. It's a little away from the diabetic foot, but I would love for anybody watching this interview to know how you decided to become a plastic surgeon, and for people who want to become a plastic surgeon, maybe.
Well, that's a very good question on the plastic surgery day. Well, while other specialties are restricted to organs of the, organ systems like nervous system or gastrointestinal system, or some are related to pathology like cancers,
Right.
or age related like pediatrics or geriatrics. Plastic surgery is not restricted to any of those. Plastic surgery is all about innovations where there are no solutions already. So we are the problem solvers. My work.
And another thing that you say about plastic surgery is it's one of the most creative jobs out there. You get to express or be creative every day in your job, for that matter.
Absolutely, because every patient is different here. There are no fixed formulas, and we need to go as the case comes, as the day comes. That's plastic surgery for you.
All right, sir. Lovely speaking to you. Thank you so much for making things a lot simpler for us. Again, diabetic foot is not something that is discussed as a byproduct of, people having diabetes. But thank you so much for making all of us aware about it. And once again, a very happy plastic surgery day to you, sir.
Yeah, thank you so much. At the end, I can only say, Sarve Jana Sukhino Bhavantu. Take care of your health and be a good and productive citizens of the country.